Hi, my name is Angela, and today I'm going to be performing a physical assessment of your nose, mouth, throat, and ears. So I'm going to start off with your ears. I'm first going to clean my hands, and then also we've already been through the health history questions. So now I can start by inspecting the ears. So the ears are of equal size. Let me get in the frame. The ears are of equal size bilaterally. And they also match, the top of the ears match the eyes, and there is no thickening or swelling of the ears. And then next, there is no redness, no discharge, and no swelling of the external auditory meatus. And then next I'm going to palpate the pinna and the tragus. So the pinna and the tragus are firm. Does this cause you any pain?
No.
Same thing on this side. The pinna and the tragus are firm. Does this cause you any pain?
No.
Okay, and now I'm going to palpate the mastoid process. Does this cause you any pain? Okay. So next, I'm going to move on to the whisper test. So I'm standing 2 feet behind him. Can you please cover one of your ears with your hand? And then, before you cover your ears, I'm going to whisper a set of numbers or letters, and then I just want you to repeat them.
6, 8, 9.
Okay. So other ear?
75.
Okay. So that is a negative whisper test, which is a normal finding. And then next, we would do the Weber and the Rhine test. We don't have the right tuning fork, but I'm just going to explain what I would do. So for the Weber test, I would lightly strike the fork, and then I would place it at the top or up on the forehead. And then I would ask the patient to tell me when they stop hearing or feeling the vibration. And then from that, I would find that there should be symmetrical distance of bone conduction. And then next, for the Rhine test, I would lightly tap the fork, and then I would put it behind the ear where the mastoid process is. And then once he stops feeling the vibration, I would put it beside the ear and ask him which one sounds louder. And it should be when it's next to the ear and not behind the ear, because air conduction is greater than bone conduction. And now I'm going to move on to the nose, mouth, and throat. So I'm going to start by inspecting the nose. The nose is symmetrical. There's no deformities, and it's midline. Next, I'm going to palpate the nose. Oh, there's also no inflammation or lesions. And next, I'm going to palpate the nose. Does that cause you any pain or tenderness?
No.
Okay, so no pain or tenderness to palpation. And then next I'm going to test the patency. So if you could sniff and cover one nostril. Okay, so the nostrils are patent bilaterally. And then next I'm going to inspect the nasal mucosa. So I'm using my phone as a flashlight. So the nasal mucosa is pink, it's moist, there's no lesions, and it's smooth. And then also there's no deviation, perforation, or bleeding of the septum. And next I'm going to palpate the sinuses. I'm going to start off with the frontal sinus. under the eyebrows? Does that cause you any pain or tenderness? Okay. Now maxillary sinus. Does that cause any pain or tenderness? Okay. So no pain or tenderness to either of the sinuses. And next I'm going to inspect the mouth. So first, inspecting the lips, they're pink and there is no cracking or lesions. And then now I'm going to inspect the teeth, gums, tongue, and cheeks. So teeth first. The teeth are white and they are evenly spaced and there's no debris. And then next I'm going to inspect the gums. The gums are pink. The margins are well defined and tight, and the gums have no bleeding or lesions or swelling. And next I'm going to take a look at the tongue. The tongue is pink, it's even, it's moist, and the papillae of the tongue is rough, which is a normal finding. Now I'm going to look under the tongue. The ventral surface of the tongue is smooth and it is glistening. Next, I'm going to look at the buccal mucosa, so inside your mouth. Okay, so the buccal mucosa is pink, it's smooth, there's no lesions. And then next, I'm going to move on to the soft palate. Okay, so open wide for me. Say ah. Okay. So when he says ah, I see that the soft palate and the uvula rise, which is a normal finding. And the soft palate is smooth, pink, and there's no lesions. Next, I'm going to look at the posterior pharyngeal wall. So stick out your tongue for me, please. And then I'm going to depress your tongue a little bit. Okay. Do you have any pain in your throat or your tonsils? Okay, so the posterior pharyngeal wall is pink. It's moist. There is no exudate and there's no lesions. And then the tonsils are also pink, no exudate, no lesions, and no enlargement. That's all.